Welcome back to Sisterhood in Surgery, the February edition. Happy Mardi Gras, everybody who is from New Orleans or surrounding areas. Today it's a perfect topic for this season, practical ideas for flourishing in work, life, and relationships. I certainly flourished this weekend. And of course, I have my co-host, Palma Shaw, here with me today, and three wonderful guests. Palma, do you want to start off with introductions?
Oh, yeah, it's my pleasure to introduce our expert guest, Amy Neuman, and who's the reason we're having this show. It's awesome, and so many people are going to benefit from it. We're going to add a new terminology to vascular surgery today called flourishing. Amy Neuman is the co-founder of Connection Labs, which is a company dedicated to helping individuals and teams strengthen their relationships both personally and professionally. The work resonates with clients from all walks of life: professors, doctors, Olympic athletes, parents, CEOs, teachers, and young professionals, because strong relationships are truly the foundation of well-being. After Amy graduated from Cornell University, she began her career as an elementary school teacher. She then co-founded Inspiring Kids, a not-for-profit focused on education and community impact. While living in the Czech Republic with her family, she designed K-12 wellness initiatives centered on social, emotional learning, and character development. Upon returning to the U.S., Amy became curious about the growing issues of anxiety, depression, and loneliness affecting communities worldwide, and including her own. She and her co-founder began exploring a fundamental question: what are the forces that lead to human connection? And inspired by evidence-based practices, they leveraged their skills as educators to create Connection Labs, where people learn and practice the art of science of cultivating stronger relationships. Strong relationships have always been central to Amy's life, giving her a perspective that is both deeply researched and personally lived. She lives in Vermont, where she loves exploring the hills near her home with her golden retriever and husband of 30 years. She also enjoys cooking, dancing, traveling, visiting her 3 grown children, and is recently experimenting with creative ways to repurpose old silk ties. Welcome to the show, Amy. We're so happy to have you here.
Thank you. I'm thrilled to be here. I've been looking forward to it.
Amy, you look very young for being married for 30 years.
It's lighting. It's like all.
That's what I say.
Our next guest is my chief fellow, Annabella Olson, who is here with me today in the studio. I chose her because she is always upbeat. And whenever, things will be hitting the fan. It's a miserable day, and she'll be like, "It's okay, we got this. It's going to be good. It's going to be good." So I thought she'd be great on this show because she is always flourishing, even in the deep depths of hell. Of some of these cases we do. But she is originally from Venezuela, but she grew up in Denver, Colorado. She earned her undergraduate degree in biochemistry at Loyola Marymount University in Los Angeles, California, and attended medical school at Western University of Health Sciences in Pomona, California. She returned home to Denver for general surgery residency at St. Joseph Hospital, and she is graduating here this summer in vascular surgery. She is looking forward to returning to Colorado. She's already signed her contract at Medical Center of the Rockies. Her professional interests include medical student and resident education and improving institutional algorithms for the management of acute aortic syndromes. Outside of the hospital, she is pretty much a pro river dancer and has taught classes nationwide, worldwide, right? Competed worldwide. That's a secret she doesn't want a lot of people to know, but she's amazing at it. She also enjoys exploring the Houston food scene, reading crime novels, and spending time with her husband and dog. Welcome.
Thanks for having me. I'm excited.
And finally, I'd like to introduce Maggie Reilly, who's a PGY5 in her research years as an integrated vascular surgery resident at Northwestern University in Chicago, Illinois. She finished her medical degree at the University of Toledo College of Medicine and is currently finishing up 2 years of dedicated research time and obtaining a master's in health services and outcomes research from Northwestern. During this time, she's worked on the vascular arm of the second trial, which is how I met her. And she's assessing the surgical trainee learning environment and strategies to mitigate burnout. So this ties in perfectly with flourishing. So I'm so happy to have her here and get her perspective.
Thank you so much for having me. I'm really excited.
Don't forget, this is a live show, so please send in your questions. You can join by web. Go to pollev.com, enter DeBakey, or via your phone, via text DeBakey to 37607 with your questions, and we will get them answered live here today. Palma, do you want to start?
Sure. So we got the idea for this webinar. When I met Amy, I was thinking, we're all working to be successful at work. We're struggling with relationships, whether it's at home, work, or other different friends we have. And we want to find a balance to sort of keep everybody happy, including ourselves. So then she brought up this concept of flourishing, which it's a lot deeper, and we're going to find that out, a lot deeper than you think. And it's very important. And so I looked it up in Wikipedia because I thought it'd be interesting to know what that really means, right? Since Wikipedia is everything. So basically, flourishing or human flourishing is the complete goodness of humans in the developmental lifespan that somehow includes positive psychological functioning and positive social functioning, along with other basic goods. The term is really rooted in the ancient philosophical and theological usages. Aristotle's term eudaimonia is one source for understanding human flourishing, and the Hebrew scriptures of the Old Testament also speak of flourishing as they compare the just person to a growing tree. Christian scriptures or the New Testament build upon Jewish usage and speak of flourishing as it can exist in heaven. And the medieval theologian Thomas Aquinas drew from Aristotle as well as the Bible and utilized the notion of flourishing in his philosophical theology. Most recently, bringing it to modern times, the positive psychology of Martin Seligman, Corey Kayes, Barbara Fredrickson, and others have expanded and developed the notion of human flourishing. So we're going to hear more about this today through our discussions with Amy, and we appreciate her time and expertise.
So fun to be here. Would you like me to offer up kind of Martin Seligman? I think that the way I think about it, most helpful, is to think about the way Martin Seligman frames it. And so I appreciate what you just offered up, Palma, in terms of the broader definition of positive social and psychological functioning. But Martin Seligman, and I think I'll just share a slide to kind of help illustrate this. That's good. Let me share this out. He thinks about it. Oh, shoot. Hold on. There it is. He thinks about it in terms of these 5 elements of flourishing. So people are flourishing when they, more often than not, are experiencing positive emotions, right? When you're feeling happy, motivated, inspired, engaged. Engagement is being in that state of flow where you just lose all track of time because you're so invested and involved in what you're doing. Positive relationships. Relationships are fundamental, foundational to human flourishing, the strength of those relationships. Being able to do things that are a source of meaning, kind of whether it's our work or anything that aligns to our values, spending time doing things that are meaningful. And then also accomplishments. And it says here, setting and working towards goals, regardless of their size, and achieving them. So those are the 5 elements of human flourishing. And what's really an interesting and kind of stunning statistic is that fewer than 20% of Americans or adults flourish, which is a pretty stunning stat if you think about it. We've worked with teams before, and it just resonates. People are like, oh gosh. In fact, I was recently working with this team, and the manager afterwards was saying how the chatter after that conversation was on how so many of the people in the room hadn't experienced flourishing in a while. So it's a pretty common thing not to experience it. But then when you understand the different elements of it, you can start to make sense of the areas in your life where, you might be doing a better job and areas where you might want to focus. Does that make sense?
Well, I think it makes perfect sense because just for example, today I was doing a carotid endarterectomy and I had a fellow, I had a resident, we have a student, and we have a scrub tech, I have an anesthesia team, and we're all working together and we're harmoniously performing this procedure and everybody's in sync. And I was worried about being on time for the webinar, but then I got very engrossed in taking care of the patient. And everything turned out perfectly, and she woke up with no problems, and I was super happy, and everything went well. But I think it was in part related to the fact that we were all very engaged, and we all knew our role. I was the lead surgeon, there was the fellow, she knew her position, and we understand that. And this is how surgeons think. We think as we are a team, and we work together. But I think that sometimes when there's toxicity, or there's an environment where you don't feel safe around your colleagues, it interrupts that feeling. And I think that's why it's so important for we surgeons to understand this concept of flourishing and all of these aspects of PERMA.
Yeah.
In your survey, Amy, with the less than 20%, I mean, how did you decide that percentage? Was it?
That was actually not mine. That was
Okay.
Key's research from a while ago. That was kind of like he did a big study, and that's what they found in the research, that fewer than 20% of adults flourished.
Wow, okay.
Broader study. And if you almost link it to when Vivek Murthy, the former Surgeon General, I think it was about a year and a half ago, when he came out with his loneliness, kind of the advisory about loneliness. And it links to this as well in terms of a culture of connection and being able to flourish. So that's more recent research, kind of how lots of people are just struggling. And when you think about these elements of human flourishing, it helps people to understand what that almost feels like in their own life. It helps give vocabulary so they can think, oh, yeah, it's not just that I'm feeling meh. It's if you look at these elements, it's that I'm feeling disconnected from people, or it's I haven't been doing things that are a source of energy or joy, or I don't feel particularly engaged in my work, for instance. It kind of helps you to dissect it. Yeah.
Maggie, what do you think as far as in the second trial, and I know you've done a lot of work looking at wellness, and we've dug into a lot of these things, and a lot of it had to do with isolation, trainees feeling isolated, there was increased burnout, suicidal ideation. How do you see this impacting all the things that you've been studying?
I think it's kind of one of the things that kind of ties it all together. In the second trial, we're looking for reasons that trainees feel burnt out, or the reasons that they might not be feeling, fulfilled by their work. And I think flourishing is almost kind of a key that I guess Dr. Shaw, maybe we've been ignoring because we've never asked any questions about flourishing, but hopefully
The next phrase.
Yes. Yeah. Next survey, we'll put some questions on it, but I think it's a really important part of it. And I think sometimes in training, you can get kind of sucked into this thought process where you think that it's not a time that you need to be flourishing or thinking about flourishing. You're just trying to get through it. But I think training is one of the times that we need to be practicing how to flourish and seeking out ways that we can do that, even if we're encountering difficulties, because you mentioned before the start of the show that the first couple of years of being an attending is super difficult. And I think that's something that all trainees know as well. If you haven't practiced, trying to flourish or find ways that you can in training, then you're not going to be equipped to do that when you first start out as an attending. So I think it's in a lot of ways a kind of missing piece that maybe we haven't really been thinking about, but I'm excited that we'll get to talk about it here.
Bella, what's your perspective as a graduating and
Fellow.
integrated?
Yeah.
Yeah.
Yeah, I think, kind of like Maggie said, as a trainee, it's very easy to just do the day-to-day grind and just try to go through the day. And you're not necessarily always thinking about the big picture. It's just like, okay, let me get through rounds, let me get through my case, let me get through, trying to get home in a reasonable time. But I think now towards the end, looking back, I feel very lucky and grateful for the training that I've had in the environments that I've had. I think I've been very fortunate to be in training environments that have been very supportive with genuinely really good people. Obviously, I don't feel like I'm flourishing every day, even though Dr. Lay says I am. Obviously, there are days that are tough, but I do feel like the environments that I've been in and the people that I've been able to work with have been huge as far as, this paradigm is as far as flourishing for sure. That's not always the case, and I think for a lot of people, for a lot of trainees, but that I think with that kind of sets the foundation for, okay, I feel happy to wake up every day. I'm excited to come to work and see these people. I'm excited to work with my team. I can imagine that would be really hard if you have a team that doesn't work well together, or people you don't want to see on a daily basis or you don't want to work with, right? And so I think that, again, now looking back at the 7 years, I feel very lucky that I've been in environments where I've had really amazing people, and I have through that been able to find meaning and yeah, I've been overall very, very fortunate, I think.
Well, I think it takes a certain person to, because especially with fellowship, right? Because you're doing it twice, kind of, right? Because you do your residency, and you're finally chief, and you're like the big wig, you know, and then you basically start over.
Yes.
And vascular surgery is a whole nother skill set. I remember when I was a first year fellow, I just felt lost again, you know, and so it's sort of like a double. But I think then residency prepares you to kind of adapt quicker. Like, okay, I've been through this before, and I can get, you know, you definitely learn faster.
Yeah. The first 6 months of fellowship, I would say, did not feel like I was flourishing at all. Just trying to, you know, get through things. But yeah, I mean, again, the people I'm with here have been amazing and helped with that a lot. So
I paid her to say that.
No,
I'm kidding.
I guess my question for Amy is like, when I look at this PERMA paradigm, to me, I don't know if this is true, but they seem sort of like a hierarchy, and I don't know if that's accurate or not. But if I think of like, you know, a hierarchy of needs, like P seems like the basics, like you have certain emotions that then sort of set the tone for the day. Then comes E, then comes R. I don't know if that's true or not, or if that's something that maybe I'm just misinterpreting, but if you could, I guess, speak to that.
Yeah, I actually don't think that's true. And that said, I think that the positive emotions one, for instance, I would say when you say it's foundational, I would say that's the one that's most closely linked to the others. They all obviously are related to one another, for certain. I do think that positive emotions, there's so much great research out there about just the power of understanding and being able to name our emotion at any given time. And being really specific about it, like the specificity of understanding how we're feeling. And let's say you're feeling an emotion that's not especially positive, being able to name it and then to understand what's behind it. Just being able to do that helps a person move through it so they can manage it in a productive way. So getting back to the idea of a hierarchy, I don't think there's an official hierarchy, but I would say that's pretty foundational just as a practice, that a practical thing that somebody can do is getting that language and understanding the power of being able to identify how they're feeling at any given time and understand what's behind it. I can actually, I can share a slide about that if that's helpful or not. Yeah. So I'm going to share a slide that this is, it's called the mood meter. It's Mark Brackett's work out of Yale. He is a research psychologist, and he studies emotions, basically. So here, there's a lot to take in on this slide. So I'm going to share it and then give you all a moment to sit with it.
That's very simple.
Oh my gosh.
Well, there's just lots of, you know, it's interesting. When you think about it here, you've got almost your different quadrants of yellow, green, blue, and red. And many people, when they think about emotions, it's kind of interesting. They don't name very many. They might say, oh, I'm frustrated or I'm angry or I'm sad or happy. But getting into the understanding the specific words here and really thinking in a moment, oh, at the moment, I'm pretty motivated. I'm eager. I'm feeling nervous or whatever it is. And then it gives you an opportunity, at least for me, when I'm trying to analyze or think about how I'm doing in a moment, it gives me a moment to separate myself from the actual emotion and then think about the why behind it, what's behind it. Anyhow, that practice helps people manage emotions when you're in a bad space. And then when you're in a positive space, it enables you to almost like a micro relive of it. Oh, I am feeling amazing because I had a fantastic lunch meeting, or I went for a run in the woods, or whatever it is, and you can start to link these ideas. And if you want, later I can share with you, there's this app I've been playing around with that is his work. And it's a way you can track your emotion. It's amazing. It's actually, I have found it to be so useful.
So is it
helpful.
better to be yellow? Wait, like is there a good area on the meter or a bad area?
Yellow
Or
is good.
So if you think about it like, if you're feeling high energy and quite pleasant, you're going to be in that yellow space. If you're feeling low energy and pleasant, you're going to be the green space. So I'd say your positive emotions are yellow or green, right?
Okay.
So if you start to look at those words there, it seems like they resonate with you. And then obviously the negative emotions are on the left side. It's high energy red, lower energy blue. But when you start to track these things and you notice over time, oh, you know what, late in the day, I'm typically in the blue, or early in the morning, I'm typically in the green, or early in the morning, I have been waking up anxious a lot. What's that all about? So you can start to kind of unpack that a little bit. It's all about building awareness, right? Does that, I'm going to throw that back to you. What are your thoughts about that?
No, I think that, it's one thing to know yourself, but what I think beyond a next skill one could use this for is dealing with your teams, right? Or functioning in a group, in your partnership, in an office. And let's say you have someone in your group who's fairly toxic, always in the red or blue. I mean, no matter what you do, they rain on your parade on a daily basis. You start off as yellow, and then you spend 10 minutes with that person, and you're like in the middle between blue and yellow. So I think that's a hard thing, right? It's one thing fixing yourself, and then keeping yourself in a positive space when you're dealing with people that don't want to be, or try to pull you out of that. I think I don't know if you can comment on that.
Yeah, so I think what you're speaking more to is this idea of managing relationships. You're not going to have control over somebody else's emotions, right? How you manage your own emotions in response to that, that's actually when you're more in touch with being able to name things, you'll be able to do that more effectively. I would say as a team lead, or a colleague on a team, trying to create the conditions for people there to have more positive emotions. Certainly, those are things that people can do to work on. What can I do? How can I listen more effectively? How can I approach places or conversations from a place of curiosity to understand how a person's feeling and why? Right? That could be a place. Does that resonate?
Yeah, I mean,
No,
I think it's how you deal with conflict.
Yep.
And how, I mean, we deal with this all the time.
Yeah.
Conflicts with other partners, conflicts with other services. I don't know. I mean, my way is just to, do my job, not get too I mean, some fights you just can't. I mean, you just gotta let it go.
Yeah. I think it's interesting.
Yeah.
I think sorry. I think as physicians and surgeons, I think we're both at times very good at knowing ourselves and managing emotions, but then at sometimes very bad at it. I think, knowing, oh, the situation's really frustrating for me, or I'm so upset at this or whatever, but then you have to, or I'm very stressed and very anxious, but then you have to suppress that to then go into the next patient room and say, hi, good morning, how are you today, right? And act like you're fine and you're happy and you're upbeat.
Yeah.
And I think I'm sure this ties into Maggie's stuff about burnout, but it's like, we know how we feel, but then at the same time, I think we only oftentimes have a very brief amount of time to acknowledge that before you have to suppress it and feel something else or act like you're feeling something else, just because of the demands of what we do daily. Patient facing in the OR, a bad situation, you're going to acknowledge that you're stressed, but you're not going to yell and scream and throw things. You're going to just take a breath, concentrate, speak with the team, communicate. I don't know. I think I don't obviously have any solutions. I think it's something that I try to improve on daily, but I think it does take a toll after a while, right? Where you feel like you have certain emotions, but you can't always express them, or they kind of build up after a while because you're putting on a good face. I think, just a comment on a challenge.
Like the second victim syndrome, right?
Yeah.
Something really bad happens to somebody else, maybe our patient. Yeah, you internally feel terrible as well. I mean, you internalize that sadness and you carry it with you, yet you have to compartmentalize that and move to the next level. And some days it feels like such a burden, it just weighs you down. And it's a matter of developing the skills and a network of friends and colleagues and other positive people. Like, I know people I definitely don't call because they're always down and negative. I'm like, no, I'm going to call this person because she's always upbeat, because I have enough negativity in my world. And so I think the positivity begets positivity.
I think it also kind of speaks to, I completely agree with what Dr. Shaw was saying and what Annabelle was saying. I think, oftentimes we tell interns when they're first learning how to be a doctor, like, when you get called to a patient room, you always have time to check your own pulse first. I don't know if that's a common phrase, but I guess we say that here. Like, you can check your own pulse first, give yourself a minute to breathe, and then go into the room. And I think this is kind of a way of checking your own pulse first and almost diagnosing yourself, like, oh, I'm feeling anxious in this moment. And I do think that naming that emotion or especially after a bad outcome and you feel just kind of so conflicted by wanting to give yourself time to think about, what just happened or what you just saw, but having to go on to the next patient and wanting to give them your best as well. I think this is such a nice way to think about giving yourself the space to process that emotion even briefly and then kind of move forward. I guess I have a question for Amy as well. Like, once you kind of have like a trend of your emotional diagnoses, like where do you kind of start when you're looking at how to, I guess, address it, or how do you know if you should even address it?
Again, I think it's also super personal, right? So I'll just give you an example of something I was recently doing when I was tracking my emotions, and I realized that I was spending a lot of time in that kind of green space where it was lower energy but positive. And I was looking at the words in the yellow, and I'm thinking, I want more of that. I want to be feeling more motivated and alive and all of those words. I want that in my life. And so I was like, okay. I was like, I think I'm going to start with that morning routine again. I started with this morning routine, which I hadn't been doing for a long time because our life around here has been pretty chaotic recently. And once I've done it now for 8 days, nonstop, and I've been doing these check-ins, and I have so many more of those yellow words. So I guess what I would say is when you start to notice things, it's building an awareness. Where am I right now? And then where do I want to be? What do I want to be experiencing? And what's going to help me with that, right? And you might reach, if a person's not in a great space, they might ask a friend who has more positive energy, let's say, what do you do to help you feel more energized? Just to get ideas. That could be a thought. But I do think that paying attention to how you're feeling, and if you want to change it, then be intentional about it and just choose one small thing perhaps that could move the needle.
I was reading a little about this topic, and a few articles mentioned that many people feel like they prosper and flourish after a hard event in their life, like something, a struggle, something unexpected. And I could see that. I mean, I guess then you have to experience the bad so you know when it's good. I didn't know what y'all's thoughts were on that.
That's like a breakup after a long-term relationship or a divorce, something life-changing.
Yeah, exactly.
Yeah.
Or, you didn't get the job you want. I mean, something that was tough. I guess.
Yeah.
I guess that's what you describe as grit, resilience, something, I don't know how to define that, but.
Well, I know Amy was going to go over some character strengths. I know there was the key characteristics that can help us, flourish and be better. Did you want to do that?
So one of the things about, so Flourishing, Martin Seligman's work in Flourishing, all comes out of his work with positive psychology. He's thought of as being essentially the founder of positive psychology. So his work around flourishing comes from that, as do these ideas of strengths, which I'll share. And I'll start with this one interesting statistic that people who know and use their character strengths, these are the strengths that he works with, are 18 times more likely to flourish. So it's interesting and worthwhile to kind of get to know them. So here, I will share them. I guess really quickly, these character strengths are the positive parts of our personality, essentially, that impact how we think, feel, and behave. So there are 24 of them. So when he and his colleagues, I'd say it was in the early 2000s, started trying to figure out what are the positive parts of our personality, they looked around the world throughout human history. They were using ancient religions and philosophies to help unpack this, and then looking at what are strengths that are recognized in different cultures. And these are the 24 that they landed on, right? And so if you think back to that idea, if we know and use our strengths, we're 18 times more likely to flourish. That makes a pretty compelling case to actually know what our strengths are.
So all 18 or 24?
24? Yeah, okay, here's I think one of the most beautiful things about this. these character strengths, the idea here is that we all have all 24 strengths, and we use them to varying degrees depending on context. And there are certain ones, kind of 5 to 7, that are what one calls your signature strengths. So all of us, there are probably 5 to 7 where they're the ones that really are core to our personality, that really do impact how we think, feel, and behave. The rest of them we use at different times. So for instance, my 2 lowest strengths, so number 23 and 24, are self-regulation and perseverance. And I use those strengths every single day, for certain. I do not use them all the time every day, but I use them every day. My top strengths of love and gratitude and appreciation of beauty and excellence, those are my top 3. They absolutely inform how I move through the world. People who know me well would say, oh, that tracks for sure. Like, that makes sense. So the thing is, when people know what their strengths are and are using them, that means they're in environments where they can really kind of be authentically themselves. So anyhow, I would encourage you, anybody who's listening, this institute here, the VIA Institute on Character, you can go to that site and you can take the survey for free. It'll take you about 10 or 15 minutes, and it'll generate a list for you of your strengths. And that's something that you can do to kind of just start building some self-awareness around this. I would offer up that sometimes people get the readout, and the first thing they do, and maybe you can appreciate this being a group of very high-achieving women, they go to the very bottom and they look at what they think are their weaknesses. And they're like, wait a minute.
Yeah, that's very true.
I'm creative, right? They do that. And this is why I want to emphasize the survey is not designed to measure your weaknesses. It's just designed to measure your strengths. And we all have them. So the second thing that people do, they'll go up to the top of the report and they might be irritated because it doesn't have the strengths that they would want to see there based on kind of what they value maybe. Maybe they think, oh my gosh, I should have leadership and creativity and judgment, and those should be my top strengths. And so I guess the invitation is check it out, sit with them for a bit, get to know them, and understand that, like, I was working with an artist recently, and creativity was number 24 for her. And she was like, what is that? And right, it was very upsetting to her. I said, it doesn't mean you're not creative. It just might be, you think that creativity is problem solving, it just might mean that your mind's not racing all the time to solve problems. You're super creative in your space, in your craft, but just might mean that you're not exercising it all the time. It's not a good or a bad. It just kind of is and is. So embrace the ones that you have. Yeah.
It's more like love yourself rather than change thyself.
Exactly. And if you find that, let's say bravery as a strength is lower for you, and you're thinking to yourself, you know what, I would like to be a little braver. I would like to take risks with my team and ask questions. Then you can say, you know, I can do that. I can lean into that. I can be intentional about that. But now you have some vocabulary around it that helps you move, again, in a more productive way.
I think it also might be, I love the idea of that kind of, maybe because I'm on research time right now, or just because I'm a science person, like I love having the data to like describe what your traits might be. But I think also, you know, it kind of may help in a team setting where if you're having difficulties with a team member or something, you know, I don't know, I was kind of thinking like during that, like, wow, okay, so, you know, people on my team have different strengths, and I need to look for ways to see their, you know, how they're using those strengths to aid the team and kind of approach interactions and create those positive relationships by playing to the strengths of my, you know, teammates.
Maggie, I so love that you brought that up, because what you're actually speaking to is it's called strength spotting. It's when you actually notice, it's like you catch your teammates exercising strengths. And when you do that, when a person does that, it's a very easy way to give positive feedback, genuine feedback. And also when you do that, when a person does that, you're establishing an environment where in acknowledging people's strengths, it means that actually when you have moments when you have to offer up maybe constructive feedback, you have you have a reserve. This person knows that you're also noticing all the good in that person and the times when they're crushing it. They're doing a great job. So now they can hear constructive feedback. Typically, it's much easier to hear.
It's really interesting.
On that note, should we talk about psychological safety?
Yeah. Sure. So psychological safety, for those of you who haven't heard the term, and I think it's a term that lots of people bristle about because they hear it and they think soft. they think, I'm not so sure about that. But psychological safety is basically when, if you're on a team, it's this shared belief that the team is safe for interpersonal risk taking. And what that means is that, people can, they can take risks, they can challenge authority in a respectful way. You can make a mistake and it's more of a learning opportunity as opposed to feeling like you're being blamed or shamed for it. In psychologically safe environments, team members value and acknowledge one another's strengths to help create that environment. People aren't undermining one another's efforts. So it kind of backing up for a moment, there's this amazing professor at Harvard Business School. Her name's Amy Edmondson. And it's a lot of her research that I'm most familiar with. And she's the one who kind of coined this idea of it's a place where teams feel it's safe for interpersonal risk taking. And she's created a whole way to evaluate and measure psychological safety on a team. So that it's a starting place. So people can see, this is an area where we can work on. But I think the most important thing to understand, particularly for high-performing, high-achieving people, is that psychological safety is not about people being comfortable all the time. It's not about being friends. It's not about being nice to one another all the time. That's not what it is. It's about creating a space actually where people can be uncomfortable, where you can bring up problems and tough issues, right? And people aren't going to go off the rails. They can hear hard things, and you can move through it in a productive way. So here, let me see.
Surgery used to not be psychologically safe, I would say, traditionally.
Say again.
I said surgery in general, the training, and even the hospital environment, like the OR, traditionally has not. I mean, now it is, but in the previous, it's been very psychologically unsafe, I would say.
Especially for women, in particular for women, many of whom felt, marginalized often by a lot of the men. You didn't get into the OR, you didn't get the cases, you didn't get, it's harder to achieve a specific level. And now, and it's not even there yet, but only now is it evolving with more women in leadership roles and women uniting and women coming together. And our show, which we would never talk about half these things, 5 years ago, we weren't talking about a lot of these topics. So I think it's getting better, but there's more work to be done.
What's interesting is that when Amy Edmondson started doing her research, she was actually researching teams in hospitals initially.
Sure.
Yeah.
And her
pathology there.
All kinds of data there, yeah.
It's like on First 48, new detectives go to New Orleans to learn how to investigate a murder. That's.
But what's really interesting is that at least my understanding of her early days is her hypothesis was that teams where there was a high level of psychological safety, there would be fewer errors. And when she got the research back, the opposite was true. There were far more errors on teams where there's high psychological safety. And as the story goes, this was very distressing for her when she first saw this. But then when she got underneath the numbers, she realized actually it's not that there were more errors, it's that they felt comfortable reporting them.
They weren't hidden.
Yeah.
They weren't hidden, yeah.
Yeah.
They weren't brushed aside, and
Exactly. And therefore you had this opportunity. It became a learning opportunity. And that, I think, when we think about leaders and people who have positions of power, when you make the case to them, like, it's actually important to invest in developing and cultivating psychological safety, if for no other reason, it'll make us better at our jobs. It'll make things better in the OR. I mean, by the way, it'll also help people flourish, but but the bottom line is, from plenty of people's perspectives, that for just the kind of the work that's being done, it'll make people better at their jobs.
If you're spending 80 to 100 hours a week being a surgeon and you feel better there, you're better at home, right? Everything is better.
Everything's better, right? When you feel seen and heard and understood at work, when you feel like people are seeing and valuing your strengths, when after you do an amazing job in the OR and somebody comes up to you and calls that out, it boosts you up, right? If in that moment you're kind of acknowledging, oh, I'm feeling pretty spectacular right now because I just got a really great call out. And that goes a long way. It's like a simple thing. So often I find that the things that make such a big impact in our lives are actually quite simple. It's just about spreading the word.
Yeah.
Are you going to show a slide?
Oh, do you want, okay, which one should I show? Let's see. Around psychological safety.
Yeah, sure.
That'd be helpful.
But I think that's important in the OR when, like, my team in the heart and vascular unit, when we do our endo hybrid cases, the team is phenomenal. I mean, you couldn't have a better team. And I feel like the techs and the nurses, they make me better and they make the case go better because it's such a positive environment.
Mm-hmm. So here I'm just showing, these are the 7 statements that Amy Evanson has to consider whether or not you have psychological safety on your team, right? The statements that have an R just means it's a reverse statement. So people are asked to respond to these statements on a 7-point scale from I strongly disagree with this to I strongly agree, right? And sometimes we'll encourage people just as individuals to think through a time or think through their work environment and consider for themselves what they would say about psychological safety there as a starting place. And then also to kind of identify for themselves which of these things are most important to you or which impacts how you feel in the environment. What's really interesting is number 7 there, working with members of this team, my unique skills and talents are valued and utilized. Sometimes we'll work with people and teams, and they will say at the team level, I don't know if my unique skills are valued and utilized. So they might say on a 7-point scale, let's say they put it at 4 or 5. But then if they think to themselves, we'll give them an opportunity to say, okay, do you value the unique skills and talents of your teammates? And they'll say 100%, yes, absolutely. That's like a 7. And then we'll say, all right, do you acknowledge out loud that do your teammates know? Mm-hmm. And then they'll go, oh, and then I'll go back down to a 4 or 5. So it just calls out, it's really actually important to name it. just say it. So people, they can't read your mind. They're not reading body language typically. So it's a good way to do it.
I have a question for the residents, the trainees, I guess, resident fellow. How do you feel would be a good balance between feeling safe but also having your independence?
In the OR or just
in general, like taking care of patients? I mean, yeah, in the OR too, which would include that.
I guess just thinking about the times where I've felt comfortable asking questions or saying, I think this is what I would do, but I really don't know. Really just being comfortable saying, I don't know, can you help me? And not feeling like I'm being judged as like my character is being judged for that, right? Sometimes you feel like, oh my gosh, this person thinks I'm an idiot now because I feel like I don't know the answer, or I can't ask for help or whatever. But I think having people that are like, oh, like you obviously are competent enough, let me just help you with this one scenario, right? I think that just being able to say, I don't know, I need help, and not feeling like your character is being
or that you're behind,
or that you're like you're not where you should be or whatever. It's funny, I think talking about this just had me think about a lot of scenarios where, like, in the OR, I mean, positive feedback, I would say, in general, in training is pretty rare. I think no words usually means you're doing okay. You know, if you're not being critiqued.
We actually
If
talked
you're
about this
doing
the other day
something-
in faculty, like, about positive feedback of, like, because you're right, like in surgery, it's very, it's hard to get a compliment.
Or like, I'm just gonna do the surgery.
I'm just going to do this.
And if the
it
attending
ends up
doesn't say
well, that's
anything,
good. Yeah, or
if I'm
nobody's
not-
going to say anything at the end.
Yeah, or like, if I'm not getting critiqued, I must be doing it right.
Yeah.
Or I must be doing it okay, right?
Is that just Methodist? I don't know. What about y'all?
But it's never like, oh, you're doing well, keep going. It's just
Yeah.
like, okay, there's silence, I'm gonna keep going, right? So it's funny that I think a lot of times just interpret that as sort of the positive appreciation of the skills, even though it's very clearly nonverbal. It's just like, okay, I'm gonna take this and run with it.
That is very true.
Yeah.
We are very nonverbal
No, but
people.
so I think, I don't know. It's kind of a simple answer, but just being able to say I don't know and ask for help, but not feel like you're being seen as less than.
Yeah.
But we could change, right? We could change and we could do that, right? No, that never happened for me. It was always like, you're terrified, just didn't want to mess things up. And thank God the case is over, nothing bad happened, right? But that's how I don't know, Linda's younger than me, but that's how I came up through training. It was just like a kill or be killed, stay alive type of thing. But I think it's different now. I think like with Maggie, it's much from what I know from interacting with Maggie and her peers, I feel like it's a very different environment. And I think that we're evolving into these people who we have to learn. The more senior faculty have to learn that feedback is good and feedback is important. And I gave feedback to my resident the other day because we had like a really difficult case. I was like, what in the world's going on with this anatomy? And she's like, no, let's just look here. I'm like, thank God she was still engaged. Kept me going. It was really good. And I thanked her after. I'm like, thanks for hanging in there. It was good. And the guy did great. But, we remember the attendings need support too sometimes. We sometimes don't get any feedback either. So we have to do it for each other.
A lot of times our feedback, like it may not even, yes, most of the time if you're doing good, it's like no comments at all. Right? But also the independence we give you, right? Like, which we should be more mindful about saying, like verbally saying that was a good job. But like, you're progressing as the years go by, we might leave you, doing something that we would never leave you as a 2 or whatever it is, right? And so
I take the not scrubbing in as your positive feedback to me.
Or like, we're running the list and I'm like, do I need to see anybody? No, right? That means that I trust her but you're right. If you didn't know, that culture is not exactly, it's very muddy. Like, am I doing well? I guess I'm doing well. Like,
yeah, for sure.
Yeah.
And I think it's also, I agree with all of that. And I think it's also possible to have psychological safety even when you're receiving negative feedback. I think the attendings who I feel like create a psychologically safe environment are the ones who I know just at a minimum like respect me and respect we respect each other. They give me the benefit of the doubt and don't assume malicious intent if I make a mistake, and are willing to kind of listen if I'm presenting a plan that ultimately turns out to not be correct. Like, they're willing to listen and think about like, okay, well, why did your thought process lead you there? That sort of thing. And so then I think, it's not that, I feel like most trainees probably, yes, we definitely want positive feedback, but we don't only want positive feedback. I think having a negative feedback is so helpful in allowing you to grow as a surgeon. But I think it's possible to do both while you're still creating a psychologically safe environment.
I think, Maggie, that's exactly right. Both things are true. Like, you want to make a space where people can give positive and negative, or positive, constructive, whatever you want to say, but like however you want to do that. Of course, that's where the learning takes place. That's you described exactly what that is, what that looks like, where both things happen.
I probably should have said constructive instead of negative feedback.
No, that's that's where all the learning is. I'll share, like, just in terms of the visual, just so you can see exactly what that looks like in terms of graph form, really, and then I'll take it down again. this I think a slide where you want to be is in the learning zone, right? So I'm sure you all are working with people all the time who are very motivated and very hold themselves accountable, right? And so when you have that, and you also have colleagues supporting one another, the idea of psychological safety, you will find yourself in the learning zone. Lots of people describe, like a lot of teams we work with, they're in the anxiety zone. There are teams that are very high performing, but the psychological safety, there's room for growth there, right? And so the goal is, how do you get them into the learning zone? And then the skepticism that we hear sometimes are for people who will say, well, what if you had too much psychological safety? And again, I said, the research doesn't show that's possible, but I think they're describing the comfort zone. And when you have teams where there is a ton of motivation and accountability, you're not going to find yourself in that zone. Like, that's just not where you're going to be.
Sometimes that's not related entirely to your current job. So or current experience, you may have a lack of psychological safety related to maybe some experience you previously had, whether it was like a malignant boss in your prior job where you felt extremely unsafe. And then even though you're coming into a new environment, you bring that baggage with you. And I think it takes a time to feel secure again, much longer than if you're de novo walking into that job.
So I think what I'm hearing you say is that if you have a past experience when you did not experience a lot of psychological safety, you might be more guarded, and maybe it'll take you longer to almost be willing to believe that you're in an environment where psychological safety could exist. If somebody's been undermining your work in the past, and you might feel like that's possible here, right? And I think it's also really important to note that all of the psychological safety is built on a foundation of trust as well. And it can take a while to develop trust with people. Like, trust is built over time. So I think that, Palma, that speaks a little bit to what you're saying, is that if you jump into a new team, having come from a really bad experience, it might take you a little bit longer to build trust with people, because you want to be able to trust somebody to ask them for help or to say, I don't understand something, right?
And it's hard to know where people are coming from. They're not going to just say, hey, I'm very highly functioning. I feel really anxious today. Just FYI.
Right.
I'm in the purple zone.
Right. No, no.
I'm in the yellow zone today. What color are you wearing today? Wouldn't that be nice?
Right. Yeah. Also, that slide I just shared out about psychological safety, that again, it's what is being experienced at the team level versus earlier when I shared that slide with all the emotions. That's what you're feeling at an individual level, right? Even in the PERMA elements, the flourishing, that's what you're feeling as an individual. Psychological safety is at the team level.
Mm-hmm. There can only be one person in the team, one person in the whole group who is talking about people behind their back or speaking badly about their partner, and that just poisons the entire environment.
It can sabotage the team.
Mm-hmm. 1 out of 8 people. It only takes one to have that behavior.
Yeah. And that's where it's interesting when I think back to the character strengths. When I find myself in situations where I have to have a difficult conversation or confront a situation that I really don't want to confront, that's where I will almost you can use the word activate or leverage or operationalize certain strengths. Like, I really have to lean into bravery and honesty right now and deal with the situation. And I know that I can because I have before. And so it's a way for me to set myself up to then go have that conversation. Yeah.
Well, we have 5 minutes left, so any closing comments or last minute questions? Things I've learned, I need to give more positive feedback.
No, I think this has been, for me, very insightful and definitely putting words to the things that we feel as trainees, for sure. And, the big transitions that I personally have been through from residency to fellowship and then about to have from fellowship to attending, just using some of these tools to really check in with myself more frequently and think about, okay, how can I make sure that I'm good and what version of me is present today? What does that mean? Why? And then how I can then bring that to my future teams as a new attending. So thank you very much. It's been great.
Yeah, I agree. I think a lot of times we don't get any, specific training on how to manage your well-being or or yourself during residency and during training, and then especially during, like Annabelle said, during the transition times where you're becoming an attending. So I think it's really cool to have these conversations, and I'm really glad that we're talking about it.
Well, I think Linda and I, when we put shows together, we just think of topics. Half of them are things I want to learn about, selfishly. I'm like, this is a good idea. I need a lot of help in this way, let us know. And we, or prior experiences are like, well, that was tough. Let's go through that again. But, I think that Linda and I try to help other people, specifically women, but other people in general, to move forward and survive different struggles that they're having. And I think that we have a hard job, and it's a hard career to have, and then to be a woman and then be true to yourself and be successful. And we don't get valued as much as we ought to get valued, and that still goes on. And it's hard to deal because then you feel like you're devalued and all of these things. So we just hope that we're helping other people, I think, with this and with other things.
I mean, when I was picturing, thinking about you and all of the incredible work that everybody here does, you're saving lives, you're changing lives, you're dedicating your life to that. And then I think about those PERMA elements and this idea of flourishing. And if there's ever a community of people who deserve to flourish, I would say it would be people like you, right? So, and that you're worthy of it, and that it is a worthwhile and important goal, I would say, to prioritize that for yourself and others. And it doesn't have to be super time consuming. It's just kind of putting a little thought around it.
Well, thank you so much for your expertise and everybody's time to be here. We appreciate it, and we will see everybody in March.
Thanks, everyone.
Good
It was
night.
great.
Thank you.
Go forth and flourish.
Huh?
Be sure you go forth and flourish.
Yes.
Fourth and